You told me before we started rolling, surgeons used to smoke in the operating room?
Yeah, they still do in many parts of the world, just not the United States. It's a performance enhancer. So nicotine will control some of your tremors, will control your hand movements. It makes you cognitively a little bit more enhanced. So it was commonplace 50s, 60s, 70s for the lead surgeon to hold the cigarette behind their back while they're leaning over, looking into like an abdomen or a chest. Things have changed a little bit, but yeah. I mean, there's a reason why people take a smoking break in high performance jobs. It's not just, one, they're addicted to the nicotine, but it does calm their nerves. There's good data and science behind it. I'm not advocating you should smoke before you do brain surgery, but it's a performance enhancer. Yeah.
Well, where do you stand on it in terms of its impact on health? Like, is it, if you can, like my perspective is if you can have a responsible relationship with it, it's just like anything else that functions as a double-edged sword. It's like sugar, like you can have a little bit of sugar here and there, but if you're a sugar addict, well, that becomes something else.
So the formal answer is you shouldn't smoke, right? But the problem is not the nicotine. The problem is all the other stuff that come with getting that nicotine. So if you were able to get pure nicotine that's extracted from additives, chemicals, tars, the additives in the paper that wraps the cigarette, it's not a problem. We slap transdermal patches on patients in the hospitals, and they do fine. It controls their cravings. They're not addicted to the patch. But the stuff that comes with the sourcing of nicotine and, cigarette smoke, vapes, all those things, that's where your problem lies. We are a culture of performance enhancement, or a culture of supplements, or a culture of doing things to change the way we feel. And that's most of the world. It's some form of vice one way or another. I have no problems with nicotine, just like no problems with any other thing. Once it affects your ability to do your daily activities or your life is when you got a problem.
Yeah, I feel like in many ways nicotine and caffeine have probably both played a large role in the building of Western civilization.
100%, man. You ban caffeine, it's like the number one used drug in the world, and you ban that, the whole world's going to collapse.
Exactly.
But it, just like anything else, caffeine's a performance enhancer. There's a limit in the Olympics and professional sports in which you can have metabolites of caffeine. Beyond that, they consider it a performance enhancer. Now, does that mean you can't have a cup of coffee before you work out or things like that? No, absolutely not. But I think with anything that you do, if it's becoming, if you need it as a crutch to get your daily activities done, or if you can't function without it, we got a problem. Aside from that, why not?
Is there any data on nicotine's impact on wound healing? Because I had a surgery recently, and I've done a fairly deep dive into the available literature on nicotine, and one thing that seems clear is that it's vasoconstrictive. So it reduces blood flow.
Yeah, we see it. We see it a lot, especially in areas that have a lot of delicate blood flow. So head and neck areas, nicotine is vasoconstricting, and that's nicotine alone, not like cigarette smoke, but nicotine itself. So it delays wound healing. And if you have cosmetic surgery, if you have surgery in delicate areas where the skin is thin, or whatever structure you have doesn't have great blood flow to begin with, the risk of that surgery having a bad outcome is much higher. So whenever I operate on the head and neck, if some people smoke, I will try to get them the patch or the gum and temporize them off it. It's the hardest thing to quit. Bigger areas, not that much of a problem, in my opinion. There's probably people out there that will argue with me, but bigger body surface areas, abdomen, arms, legs, things like that, doesn't seem to have that much of an impact just because we have so much good blood flow. But delicate areas, nose, eyes, ears, lips, fingers, hands, already fine perfusion areas, it tends to be a problem.
Super interesting.
Yeah.
I will use it occasionally as a nootropic, but I'm not addicted. I stopped cold turkey, and it was super easy to do actually for the month prior, or maybe even 2 months before my surgery, and then I didn't touch it for about a month and a half after the surgery, and I'm now about a month and a half out.
It helps you focus, man. It really does. I mean, there's hundreds of years worth of data on it. It's a performance, cognitive enhancer, physical performance enhancer. Nothing wrong with it, so long as it's not affecting, 1, your health, and 2, your ability to do your activities, daily living.
Yeah. Wow, I love that insight.
Yeah, man.
Well, you are a a skin expert, and
I appreciate that.
yeah, and we haven't. Well, you've put in the work, my brother.
I appreciate that.
You know, you've got those credentials
man,
after your name,
the
and
more I practice, the less I feel like I know. I guess that's the sign of getting really deep into anything.
I get it. Well, what would you say are the most common mistakes that people make with their skincare routine? We'll start off the deep end.
Yeah. I see this all. I tend to be like the dermatologist. I'm a very simple guy. The majority of what I do tends to be complex and high risk skin surgery and reconstruction. I see some of the worst patients in Los Angeles. So my lens is a little bit different. I tend to be a simple, less is more type of guy. I think because the cosmeceutical world is a multi-billion-dollar industry, it's easy to tell people to do, a 17-step routine when in reality you need like 3 fundamentals: something to take the dirt off your skin, something to protect you from excess UV, and something to turn over your skin or kind of keep it healthy or young. Aside from that, everything else is like frosting on the cake or the cherry on top, but you got to build your cake first. So my routine's very simple: have a good wash, have a good moisturizer, a good sunscreen, and a retin-A or some form of retinoid to help your skin stay young. And that's about it.
What are the retinol creams like? What are those?
Yeah. So this is stuff that came out in the 70s and 80s, and it kind of has a dark story as how it came about. But these are hormones, hormone molecules that will turn your skin over. For many years, we used it for acne. It gets rid of acne. But what we found over 20, 30, 40 years of data is it actually makes your skin biologically younger. It improves fine lines and wrinkles. It gets rid of sunspots by basically bringing out stem cells faster. It brings out baby skin to the surface. We have new skin every 28 days. Most people don't know that, but our skin is entirely shed, kind of like an animal, every 28 days. So when you use these products, it speeds it up to 7, 9, 10 days. So it brings out healthier skin and kind of gets rid of the collected damage, environmental, sun, what have you, that sits on the surface of the skin.
Whoa. Is this something that everybody should be applying?
Yeah. It's like a no-brainer. Every dermatologist has a secret, and it shouldn't be a secret. Everybody's on it. It's like one of the few things I use, and I use it nightly.
Retinol.
Yeah, retinoids. Yeah,
that's vitamin A, isn't it?
Yeah. So people mistake that term interchangeably: retinol, retinaldehyde, retinoids, vitamin A. It's a derivative vitamin A. So if you went to Whole Foods and got a bunch of vitamin A tablets, all you would have is pressure on the brain and some liver toxicity. So don't do that. But it's a derivative from vitamin A, and the active versions are prescriptions. The most commonly known one is tretinoin. There's also other ones like isotretinoin, which is Accutane. It's a pill version. There's tazarotene. These are active retinoids, which are derivatives of vitamin A that have specific effects in the body and the skin. Because they have very specific effects, they can have consequences if you take too much of them, if you use too much of them, if you happen to be pregnant while you use them. So the FDA regulated them, rightfully so, because there were some bad things that happened in the 70s and 80s. The cosmeceutical companies like, hey, this is a great product, but we can't sell it. How do we get around this regulation that makes it a drug? Let's make an inactive version called retinol. That we can shelf because it's inactive and people can buy it. It requires your body to convert it to the active version. So if you go to, Sephora, Nordstrom, Bloomingdale's, where have you, and you see retinol, they're actually the inactive version. So if you want a good active product, it's a prescription, but the inactive versions can work so long as your body knows how to convert them. But they're amazing. They're amazing drugs. They're like the only thing that actually reverses aging, biologic aging, like verified. It's the only thing that reduces cancer risk. It's the only thing that treats acne. Yeah, they're amazing.
Whoa.
Yeah.
Well, I'm confused. So inactive doesn't mean that it's not effective.
No. But the big question is everybody's body's ability to convert it into the active form is variable. So you have to have the enzymes and the ability to convert it. So for some people, myself included, the over-the-counter stuff is completely inactive in my skin. I can't convert it. My wife, for example, is very sensitive. Seems like she can. So the unknown is kind of hard. You may be spending a lot of money buying expensive cosmeceutical products and it doesn't do anything, whereas a simple prescription will take care of it.
Very interesting.
Yeah.
What today would you say are the biggest barriers to having healthy skin? healthy, attractive, youthful skin?
Oh man,
I mean, you mentioned UV rays, like
Yeah, yeah.
excessive UV rays.
Yeah,
That often comes up.
it's a good question, man. There's a lot of noise in everything we do now. There's a lot of like noise, misinformation. Like we've lost sight of big pictures of things, and we've honed in on things that make it like a 1% improvement, and have forgotten 99% of it. And this applies not just to skin, but to health in general. You know, we've come from a country where being outside and working and eating, you know, normal farm to table foods was okay, to a society where, you know, my collective specialty will say, stay out of the sun's going to kill you, but take this pill to replace the vitamin D that you needed, you know, take this pill to replace this that you should have had from your diet. I think the noise is a problem. To a certain extent, your skin is genetically defined. If your family history had a lot of cystic acne, you're probably going to have cystic acne. If you had a strong family history of skin cancer, you're probably at high risk. But we spend so much time looking for the miracle pill or the miracle cream, and then you take a step back and look, and you're like, well, you're not eating great, you're not sleeping great, you're not getting outside, you're not exercising. Well, those easy adjustments are often overlooked. So I think society's noise is one big consequence in terms of having good skin. There's so much information out there. You go onto, I don't know, Instagram, TikTok, you know, any website, and you'll find 50,000 ways to treat the same skin condition. I don't know if that's the right thing to do.
Does diet have an impact on skin?
100%. And that's overlooked in almost every residency specialty and almost every training program in the United States. There's some that are, you know, forward thinking. I trained up at Stanford, and they were very forward thinking in that there's absolutely a connection between the gut and the skin. The immune system in the gut and the immune system in the skin dictate a lot of the inflammatory processes in the body. So we know from things like eczema, from psoriasis, you can improve and control disease by just modulating your diet. And the most common diet that I have people start on is an anti-inflammatory diet. And it doesn't have to be any specific one. There's a whole slew of anti-inflammatory diets online. You can kind of figure out which one works with your body, but we know that you can get almost a 50% improvement in mild skin disease just by diet change.
Wow.
Acne, like we see this commonly in acne. You know, young kids come in with acne, and you ask them what they're doing. They're, you know, staying up all night. They're having 2 liters of Coke. It's finals time. You know, they're stressed out. They're having a Hershey bar, and then they're like, dude, my skin's breaking out. Well, sugar will drive your acne. We know this very well. And it used to be a misconception that dairy drove acne, but it's actually not the case. We found that in a really cool study that came out of Penn State, non-fat dairy products drove acne, but full-fat dairy products didn't. So when we looked into that, in the United States, a lot of manufacturers put certain emulsifiers to give the mouthfeel for non-fat dairy products to feel like full fat. Those emulsifiers are basically sugar derivatives. So they have the same insulin effect that if you had sugar. So we found that the non-fat dairy products were what spiked patients' acne, but full fat didn't. So it goes back to sugar again for acne. So if you cut out excess sugar, you cut out non-fat dairy products, you get about a 20 to 25% improvement in your acne. Does that mean you can cure your acne? Probably not. If you have mild, maybe. You can definitely improve the severity, and that saves you from another medicine that you need. And here's a medicine guy telling you don't need medicine, you know, blasphemy. But yeah, dude, diet's huge. Diet's huge. You know, the skin-gut connection, we're only now understanding. Like the amount of inflammation, the amount of things that are happening in the gut is mirrored in the skin. And the skin's really cool because it's the first organ you can see. Like, it's really hard for me to look at you and say, hey man, I think your liver's like not doing okay, you know, until it's like too late. Or like, hey, your colon's not, you know, digesting this. But you can see it in your skin. You can see it in the effects of, you know, how your skin disease is doing. If you're looking sluggish, you know, we talk about this all the time. There's a look when people are ill, right? But there's a reason your body looks like that. You know, you can right away, if you see somebody and they look like this certain paleness, gauntness, hollowing around the eyes, you know they're ill without even having a lab test. You have no idea about them, but you know they don't look good. And that's your body's ability of saying, hey, there's, excuse my French, there's shit going on inside, and I'm going to show you this way.
My understanding is that there are at least a handful of signs visible on the skin that you're eating, we'll say or a pro-inflammatory diet, or maybe the signs that you have hyperinsulinemia, insulin resistance, skin
100%.
tags comes to
100%.
mind.
Yeah.
Also, people with type 2 diabetes, don't they have dark?
Yeah.
So
And that's like from years of, badness. So we see like this velvety brown discoloration start to occur around the neck, around under the arms and skin folds when patients are basically pre-diabetic or diabetic. The constant insulin drive stimulates the skin to overproduce skin, essentially. We call it acanthosis nigricans, which is not a nice Latin name, but now that I think about it, but
It's a mouthful.
Yeah. There's skin tags, growth that shouldn't be there. Everything's driven by insulin and IGF-1, which is a pro-growth hormone factor. Eczema, patients who don't normally have rashes, when they have a high insulin spike or they're eating pro-inflammatory foods, think Western diet, white breads, white starches, processed carbohydrates, kind of yellow-brown foods. If you think about uniformly yellow-brown foods, they have rashes that show up that normally won't be there. We collectively pile them under the eczema or atopic dermatitis pile, but even in people without childhood eczema can develop this when they have a really poor diet, and it's like the perfect storm. Your gut's not happy, the inflammation spills over, and the easiest place to manifest is the skin.
There was a case report recently that was published, kind of made waves on social media, went a bit viral, of somebody who was on like a crazy iteration of a carnivore diet. He was eating blocks and blocks of cheese every day. Did you see this?
Yeah, hands.
And he had like these yellow lesions like in his hand. What was that about?
Eruptive xanthomas or tendinous xanthomas or xanthelasma. Normally, these aren't associated with high triglycerides, meaning high fat in the blood. And people often mistake these two things in diet. Cholesterol and triglycerides are not the same. And ironically, cholesterol is generally not food driven. So people who have high cholesterol, it's usually genetically defined, their body's producing. Whereas high triglycerides, for the most part, can be modulated by diet. So if you eat too much fat, essentially when your blood type becomes butter, it spills over into the skin, and we see it's essentially fat that's oozing into the skin. And commonly we see this in areas like the upper eyelids, lower eyelids. I actually operated on a lady yesterday to remove them, and her labs are normal, so hers were genetic. And about 80% of the people who have this have normal lipids, but in 20%, you find that, hey, their body's way out of whack. So the carnivore diet, just like anything that's extreme, like extreme one way or another, is probably not a good idea. We're not meant to do that. But the amount that guy was eating, I'm surprised he didn't have any other manifestations besides that. The first thing you'd probably see is like just pancreatitis. It was wild. And that usually is permanent.
Permanent?
Yeah.
Wow.
Yeah. The body won't generally reverse it once it's in the skin.
Yikes.
Yeah.
Damn.
Yeah.
So eating like an excessive amount of dietary fat, as this guy was from the case report, like that can definitely drive your triglycerides up. But triglycerides, despite being fat in the blood, can also be driven up by excess carbohydrate intake.
100%. Yeah, for sure. My point in the triglyceride versus cholesterol is people often mistake the two, and they're not. And triglycerides can very well be diet modulated, whereas cholesterol is a little bit harder to modulate diet-wise. And when we see patients with certain skin findings, we always look for internal sources of their cause. What you brought up, which are called xanthomas, eruptive xanthomas. We always get blood tests to make sure, hey, we're not missing something internally. Get a dietary intake. Hey, what's your diet? What are you doing? There's a lot of things that we look for internally and diet based when we just examine the skin.
What would you say are the worst foods to eat from the standpoint of skin health?
Oh man, anything that's high in sugar, man. A chocolate bar and a Coke, and I'm like already cringing, And there's nothing wrong with indulging in it every once in a while, but it's when your body constantly, imagine driving a car and keeping your foot on the accelerator and just keeping the engine at red line. After a while, it's not going to like it. You can do it the first year that you had it, the first couple of years that you had it, but after a while, it's going to start to break down. So the worst foods are high sugar diets.
It's like all gas, no brakes.
Yeah, exactly, man. That's like
biology.
literally, yeah. And Your skin is one of the few organs that regenerates. Most of your organ systems don't. Your liver can, your intestines can, and your skin can. And you actually have the same phenomenon that happens in your gut and your skin. You get a new lining every 28 days. They mirror one another. So things that can regenerate will start to show you problems faster, you know? I actually think high protein, high meat diet is beneficial because it tends to be anti-inflammatory. Now, does that mean you should go eat 8 sticks of butter? Probably not, you know, but I myself, high meat, high chicken, high fish, moderate vegetable, high fruit. It fits my body.
Yeah. Well, meat is not inflammatory. People
No.
have this misconception about meat that
No,
it's
absolutely not. No. And the stuff that we found out in the 70s and 80s that have been recapitulated and burned into our textbooks, because you got to remember our textbooks were written from data that's 10 to 15 to 20 years old. By the time it makes it to press, it's outdated. So the stuff that we understood about heart disease, the stuff that we understood about cholesterol, plaques, skin disease, what have you, is antiquated data. It's actually not the fat, it's not the protein, it's the inflammation caused by sugar. So it's fascinating. There's nothing wrong with eating a lot of meat. Obviously, don't do what that guy did. He's probably eating not the best things, but
Well, it doesn't sound like it was the meat that was the problem for that.
it was the butter.
In that case report, it was like all of the added fat that this guy was
100%,
eating. Like
100%.
Yeah, I mean, we had recently Lillian Nichols, who's a dietitian, on the show recently, and she was saying that there's really no downside to even over consuming protein, which is difficult. It's hard to do because it's self-limiting. It's so
satisfying. Yeah, exactly right.
But like when you prioritize protein, you actually you become less hungry for the sugar and the carbs.
100%.
And the added fats.
100%. Yeah, interesting you bring that up. There is one thing that I found just, going through my training, and I think I've been in school for 100 years now. My wife says I'm a forever student, but your brain only runs on glucose. And I found that in periods where I diet, if I needed some cognitive performance enhancer, if I had a burst of carbohydrates, things clicked, ideas clicked, projects worked. So I found that really restrictive diets, in my opinion, for most people, tend to not be that great cognitively. But I think if you were going to pick one diet for your skin, one diet for wellness overall, it's a high protein, low anything else diet.
Yeah, certainly one that revolves primarily around minimally processed foods. Yeah, for sure. What about nutrients that benefit skin health? I mean,
yeah, there's a whole slew of them, man. I mean, we touched on vitamin A. That's like the fundamental building block for the retinoids. Now, vitamin A itself has been a real problem because people will read this, hear this, and they'll go out and try to supplement with just vitamin A, and you can get into really, really big problems. The two most common are pseudotumor cerebri, which is a fancy name for pressure on the brain, and then the other thing is liver toxicity. So vitamin A's derivatives have been amazing. We actually use them to treat cancers of the skin, like certain lymphomas and certain cancers. So vitamin A is a big one. Vitamin B comes in various flavors from 1 to 12. Vitamin B is massive in the skin. It plays a huge role. A derivative of vitamin B3 called nicotinamide has been shown to correct DNA damage in the skin. We actually published this data in the New England Journal of Medicine, our most prestigious medical journal in the world, where patients took a certain dose of nicotinamide for a year, and it cut their non-melanoma skin cancer risk by up to 30%. And these are people who already had skin cancer. They were high risk. They've had 2 or more. You know that their likelihood is more than 50%. When you looked at the core, and this is just a supplement. This is not a prescription. It's over the counter. It's water soluble. You take too much of it, you pee it out. And it had better improvements in skin cancer reduction than any other prescription we can give. So that's really cool. B7, biotin. There's good data that it can strengthen nails. Not so great data about hair, though it's marketed as a hair product. Doesn't really do much, but there's good data that it strengthens nails. There's a lot, man. I think the vitamin world, vitamin C, collagen's a big kick, right? Everybody likes taking collagen. And collagen has like this huge effect on skin hydration, skin laxity, fine lines and wrinkles. But without vitamin C, your body can't convert the amino acids into the triple helix for collagen. So vitamin C, I used to see this in New York more than I saw in LA, but every couple months we'd get a patient that would come in and They had bleeding gums. The hair on their legs or arms or chest was falling out, and they had scurvy.
Scurvy?
Yes, scurvy. We see it in people who have very restrictive diets. Some people have like food disorders or phobias to certain foods, so they have very limited diets. So probably 2 or 3 times a year, we'd see in the modern world in New York City, you'd see people with scurvy. So you just give them a little vitamin C and everything reverses.
That's wild.
Yeah, it's crazy. I mean, simple vitamins, and we'd laugh and joke, but that Flintstone a day back in the 90s actually did something.
Damn.
Yeah.
Vitamin C is crucial when it comes to collagen production.
Yeah.
Right?
It's essential. You can't make collagen without it.
What about collagen supplements? Are you a fan of those?
Yeah, I think so. When they first came out, everybody was like, I'm not sure about this. Where's the data? Where's the data? The reason for that is collagen is made with 3 amino acids, proline, lysine, usually hydroxyproline or hydroxylysine. And those are made from non-essential amino acids, meaning your body can convert whatever you eat and make those 3 amino acids, which will then eventually become the collagen triple helix. So people would say, well, if you're eating a good diet, you're probably making enough collagen that is sufficient for your body's needs. So at first it wasn't great. Then we looked at studies that came out in the last 5 years that looked at collagen supplementation and improvements in skin quality and health, and the data is there. So the people who supplemented with collagen did look a lot better, both aesthetically and health-wise, than people who didn't. So I recommend it. I like it. I don't think you need a lot of it, especially if you have a normal diet. But if you have a very restrictive diet, or you don't have a great source for amino acids that your body can utilize, then maybe you need a little bit more. But I'm a fan.
What do you recommend patients look for when assessing a collagen product?
So, great question. So you want to see source. A lot of animal sources tend to be better bioabsorbed than plant-based sources. So depending on your belief system, you may want or don't want animal sourced collagen, but bovine collagen tends to be a lot better absorbed. The algae-based ones, the marine ones, tend to have an 18 to 28% absorption rate. So plant-based proteins tend not to absorb as well. But if you want something that's readily bioavailable, you want to see if it's hydrolyzed or if it's in peptide form. So the manufacturer has done at least some of the breakdown, because some people can't break down proteins as well. It can give them some GI upset depending on your genetic history, your body's ability to break down proteins. So hydrolyzed peptides tend to be much more bioabsorbable. You see the spike in the blood protein if you draw their blood much faster when you consume hydrolyzed peptides as opposed to just full form collagen. And then just where is it sourced from? Is this a reputable company? Am I getting a lab made product, or is it an actual bovine or animal source protein, things like that.
But it's a myth at this point that you take collagen and just gets completely broken down. Like some of the collagenous peptides do get absorbed intact.
Yeah, for sure. Yeah. But interestingly, if you do a stool sample, about 80% of what you consumed will be detected in the stool. So the absorption is low, and people have various permeabilities and ability to absorb it, but it's not broken down into single amino acids. That's done actually in your bloodstream. You usually break them down into long multi-peptide forms, and then your body absorbs them to a certain degree and then utilize them how be. Now, the problem with collagen supplements, just like any other protein supplement, is asking the question, how does your body know where to take it? So there used to be a lot of marketing saying if you take this, it goes straight to the skin of your face, and unfortunately that's not true. Your body, it goes in your bloodstream and there's circulation everywhere. But the body's amazing in knowing that it funnels it to where it's utilized most. So gut, skin, turn over collagen at a really high rate and utilize collagen at a really high rate. Your bones, ligaments, tendons, depending on your age, are either still actively replicating and growing, or they're static. So they tend to use it less. But the thought that you can take collagen and it'll go to a certain area is not true.
Well, probably good reason to take more of it, right? Like the more you have in circulation.
Yeah, again, kind of goes back to your diet. So if you have a good diet, you're going to excrete the stuff that your body doesn't want. If you don't have a great diet, then you will utilize and uptake the stuff that it needs or is deficient in. I think after about 15 to 20 grams, if you're having a good, healthy, balanced diet, you won't absorb that much. But, so looking for something around that line and looking for something that has vitamin C with it. So that's like a simple way to ensure that at least your body can utilize it. They're taken up together. Vitamin C is a water-soluble supplement as well, so you don't have to worry about taking too much. But if they come together, then okay, my body will be able to utilize it and rebuild it.
Yeah. I've been collagen maxing hard since my surgery, and I actually was like preloading collagen even before the surgery, and I feel like my recovery has been super fast.
It's actually a really good study to do. I mean, we can probably do that in the practice, is look at split patients and look at how their wounds heal. If you supplement them pre and post and you just look at them heal normally and compare timelines, it makes a lot of sense. You're utilizing, especially incision sites, you're utilizing collagen. It goes from type 3 to type 1. It takes about 2 to 3 weeks for that transition to occur, sometimes up to 3 months. So your timing makes a lot of sense.
Yeah, I mean, I'm generally like a big fan of it. I know it's not a replacement for, like whole proteins, like whey protein, if you choose to supplement with whey or, whole food animal source proteins, but yeah, 1/3 of the protein in your body is collagen. Is it not?
Yeah, that's exactly right. The other important thing to know is there's like a timed absorption that we know. So every 2 to 3 hours, a lot of the metabolites for proteins are excreted by the kidney. That's why we look at nitrogen balance in the hospital when patients come in. You look to see if they're nitrogen positive, if they're nitrogen negative, if they're breaking down proteins or they're anabolic or building proteins. So timing absorption, sometimes people take like 100 grams in one interval. It will do you no good, as opposed to 5 intervals of 20 grams. Spaced over the day. So that's an important thing. And I think the other thing that collagen does, and to extent any other protein supplement, is it draws in water with it. So when you consume something that's high in protein, it increases the osmotic gradient of your blood, or the oncotic pressure. So water comes into the bloodstream and it draws water to wherever the protein goes. So that's part of the reason why when people supplement, their skin looks better. They're more hydrated. They look less tired, as there's a little bit of a water draw with it. When you're healing from surgery, injury, what have you, you need that. That volume is also key into, it's like keeping a plant that's growing, well fed and watered.
How much water should we be drinking every day for optimal skin health and appearance?
That's a great question. I'm going to upset a lot of people by telling them this, but water consumption has absolutely no impact on skin hydration.
None?
Zero. Zilch. Until you're dehydrated enough that you need to, get an IV infusion or something like that. But water consumption has no impact on skin hydration. And we looked at a myriad of studies that looked at if you drank, 4 glasses, 8 glasses, 12 glasses, and looked at transepidermal water elimination or how much the hydration status of your skin, there was no change.
Wow.
The hydration status of your skin is dictated by the skin itself, not your body's hydration status. Only when you become actually clinically dehydrated, you played an hour of sports outside in the sunny day and you lost a liter of sweat, sure, by all means, that's clinical dehydration. But if you're otherwise not dehydrated, sedentary, or you're replenishing your fluids, there's no correlation between skin hydration, skin water levels, and the amount of water you're consuming. We generally say somewhere around 8 to 12 glasses, which is not cups. Glasses are, we use these terms interchangeably. I don't know where they came from, but it's somewhere around 64 ounces. If you're more active, if you're larger, somewhere a little bit more, 96, 128. But the other important thing that we do notice is people who drink an exorbitant amount of water for their body size, gallon plus, do get an eventual flushing of some of the minerals that are needed. You become mineral depleted, vitamin depleted.
That's not good.
No, it's not. It's like, when the rain washes out the hillside mud. If you get too much water, it'll eventually erode out the rock and things like that. Same concept. But somewhere between 64 to 128 ounces, which is half a gallon to a gallon a day, is sufficient, for most people. But if your skin is dry, you're not going to fix it by drinking water.
Wow.
Yeah.
So that's just lore about skin health and appearance that we've all collectively come to accept as fact.
Yeah,
Similar
yeah.
to like the 10,000 step per day.
Yeah. It
Mantra.
probably, and it probably came from data we had in like the 20s, 30s, 40s, when people were living a very different lifestyle. Access to water was probably not there. You had a farmer who had 1 cup of water his entire day, sees his dermatologist for dry, cracking skin. He's like, hey, how much water you have? I had a little well water yesterday, But we live in a different era, so that mantra's changed. And you can see that because kids, newborns, babies that have eczema or their skin's really dry and rashy, I mean, their water level is very well controlled by either breast milk, formula, what have you. It's so tightly regulated. And when we look at hydration status of the skin and we look at their fluid status, there's no good correlation.
What are your thoughts on red light photobiomodulation?
Love
Do you
it.
have any? You love it.
Love it. So light plays a huge role in everything we do in medicine. Light's been in medicine for a long time. We only now have we gotten technologies good enough in which we can utilize light very precisely. But I mean, the old antiquated way to treat psoriasis in the Middle East was to lay in the mud in the Dead Sea and let the sun shine on it. It was like what we now call the Geckerman regimen, which is a way to treat psoriasis. We use light and all spectrums of the light. So red light I love for things like anti-aging, rejuvenation, stimulating a little bit of more blood flow and vascularity, and upregulating certain things like VEGF, PDGF. These are factors that are related to new blood vessel growth and new skin growth. But we use visible light to treat certain skin conditions. We use visible light with certain medications to treat sun damage and precancer. We use UV to treat things like psoriasis and eczema and vitiligo. We use certain wavelengths of infrared, near infrared light to treat certain skin diseases. So all spectrums of the light are utilized. We've just now figured out how to hone it so that you don't get all the other noise that you don't need.
So the devices are not BS?
Great question. Most of the stuff, so generally speaking, light-based devices don't have FDA approval. And this is a common misconception. People use the term FDA approval and FDA clearance interchangeably. And for most devices, whether they're in the physician's office, surgeon's office, or direct to the consumer, are FDA cleared, not approved, because they're not a drug. They're not or a device used to treat, diagnose, or cure a disease. So then it comes to FDA clearance. The requirements for clearance are much lower. You just got to show that it's not going to hurt someone. It's not going to kill someone. You don't have to show efficacy in treating disease. Then it comes down to the spectrum of stuff that's FDA cleared. Most of the stuff that's direct to consumer, unfortunately, is not excellent. It's either not powered high enough because the manufacturer doesn't want any bad outcomes, rightfully so. So the stuff that they sell isn't powered enough to cause any benefit, or it's not the right device, or not the right intensity, not the right distribution of light, etc. Some light devices over the counter or direct to consumer are good, but for the majority, simple rule is if you can plug a battery pack into it, it's probably not powered enough. If you can purchase it and you can use it, with unlimited finite time, it's probably not powered enough, or it doesn't have the enough density of light, or the distribution of light bulbs isn't enough to get the effects that we've seen in clinical studies. Some devices are great, and I don't speak for any device, so it doesn't matter. It doesn't matter which company we talk about. But generally speaking, the ones that have been shown to work tend to be controlled and sold for offices, just so it's a little bit more regulated in bad outcomes. If something happens, who's liable, who's at risk. So unfortunately, we live in that kind of country. But a lot of the stuff you see over the counter doesn't work.
Yeah, I'm sure there's huge variation.
Yeah.
Product to product, especially when it comes to these direct-to-consumer products.
I mean, we have red light in my office. I love it for things like hair growth. Patients come in for hair growth or hair restoration, or they need some sort of tweak, and we do either procedures or we give certain medicines. But the red light itself has been shown to improve just hair growth by about 20%.
That's insane.
It's awesome.
How does it work?
It's thought to increase blood flow. So one of the theories behind traditional hair loss, which is like male pattern baldness or female pattern baldness, is the follicles shrink partly because there's less blood flow to the bulb of the follicle, kind of like less water to the plant. So you kind of turn the hose back on, or you bring the hose closer to the root, and the red light stimulates that.
Very interesting.
Yeah.
Yeah, I have for many years I had I still have my Juve device, which you plug into the wall and it seems super bright.
Juve is great.
And it's got you've got the red lights, which you can perceive, which get to us, which are able. My understanding is they're able to penetrate to a certain depth into the skin, and then there are these bulbs, which is very funny. You don't actually see them as being on because they're outside. They fall outside of the visible spectrum, right? Yep. But those are able apparently to penetrate even deeper.
Yeah. Juve is one of the brands that has been very effective, and it's direct to consumer.
And they're like OG, like
exactly.
And now I have a Sunlighten version of it, which is my Juve panel. Like it's a huge Juve panel, but one of the panels stopped working. So rather than having gotten it fixed, I just got like another device. But yeah, I was using it on the incision site. I had spine surgery I didn't.
Hopefully you're okay, man. I
mean,
I had no idea seeing you walk, so that's good.
No, it's great. Yeah, it's great. It's been like life changing for me. But yeah, I was using afterwards the red light like on the anterior incision site as well as on the back.
Yeah. I love it for fresh wounds. I love it for wound healing. I love it for anti-aging and rejuvenation. And it comes, there's a couple of interesting things. You brought up a few points I want to talk about light. We knew people's wounds would heal better when they were in the sun for a temporary period of time. This is data from the 40s, 50s, and 60s. And we didn't really know why until a lot of research was done on just wound healing and understanding how wounds heal. So you bring up something that's really important. Definitely, I think non-UV based light, especially in the red spectrum, helps wounds heal a little bit faster because of that increased vascularity and increased blood flow, which allows wounds to just mature faster. But you brought up sunlight, right? I used to live on the East Coast, and for me, the gray would affect me, So one of the recommendations from some of my colleagues is get a light box. And, there's something that you can't measure in a laboratory test or a physical exam, and that's like your well-being, how you feel. And the fact that one of the therapies to just feel better is get a source of artificial sun in your room because the day is cloudy says a lot. And we ignore it really easily. And, some people aren't affected. My wife didn't care at all. She loved it. Like she loved the soup rainy look, and sit by the TV. I couldn't
hate it.
I couldn't tolerate it for a while, First month, okay. Month 8, I'm like, I need some sun. So there is a component of well-being that comes from light that trickles down to organ systems. And that, unfortunately, nobody can test in a test tube. Nobody can test in a measurement on an exam. But when you feel better, your body behaves better. It heals quicker. It's healthier. It's the same reason why when people go on vacation, they come back, man, you look good. You look well rested. Even though you may have been like out hanging out, surfing, partying, doing whatever. But there's a reason there's a glow after vacation. It's not just emotional. It's biologic. It's really cool.
Isn't there, because one of the things that I was instructed to do post-surgery is not to get sun directly on the incision because that can cause discoloration.
Yeah, that's temporary, and it occurs more in people who have the ability to tan. So if you normally have olive skin or you have the ability to tan, then what happens is if you get a lot of UV on a fresh incision, it just stimulates the cells that produce our skin's color called the melanocytes to make more melanin temporarily. Or sometimes you can get what's called post-inflammatory pigment. So those cells are kind of like little baby octopuses. They spit out ink temporarily, and it's not consequential. It'll fade eventually, but it's kind of ugly looking for a while. So we shield it from UV, but interestingly, red light works great.
Any tips for reducing scar appearance?
Yeah, man, scars are tough. Scars.
Well, I've been using these
C-section
strips, like these
silicone.
Yeah, silicone.
Yeah. So scars. I just actually gave a lecture in Florida this weekend on, and one of the things was scar revision. And I see a lot of patients from Los Angeles for scar revision for either surgical scars or traumatic scars. Scars are simply put a problem of collagen. You either have too much collagen, you either have not enough collagen, you either have uneven distribution or breaks in the collagen. So one of the simplest things that you can do for an incision to look as minimally visible as possible is to keep it moisturized. If you think of like brick, like the wall here, in between the brick, you have mortar. Your skin is the same. You have keratinocytes, which are your skin cells, and the ceramides, which are the oils or the fat equivalents that seal the skin layer on the surface. So when you make an incision, you break that. And in order to help the wound heal, you keep it moisturized. Now, the simplest thing I recommend patients to use is something like Vaseline or Aquaphor, even though that may sound crazy. The petrolatum, it's not petroleum, but it's petrolatum, is the closest thing to our skin ceramides and can be absorbed without causing your body to have an immune reaction. So they're inert. But you bring up silicone scar sheets, which is another excellent way to basically lock in that moisture. When we look at split scar studies in the plastic surgery literature, there's really no difference between using plain old Vaseline or Aquaphor or silicone scar sheets. But what silicone helps do is you just kind of set it and forget it. You put it on there and you go about your business, whereas like ointments, you got to apply multiple times a day. But that's number one thing is keep it moist. Number two is keep it out of the sun. And then the third thing that is kind of not in your control is, how the surgeon sutured things up or how the injury occurred. And then the fourth thing is tension. So we talk about this all the time, but why we restrict physical activity, partly because, your body's got to heal. But number two is you're much stronger than any thread that's made in the world. So, you bend over and you'll pop those sutures right open. But even if you don't pop them, over time, there's a lot of stretch on that scar. Think of an accordion. That stretch, your body says, shit, this scar is being injured over and over and over again every day. This guy is bending over to tie his shoes. He's playing basketball. He's, jumping up and trying to dunk. Let's thicken this scar as a defense mechanism. Let's put more collagen in there so it doesn't break. Because scars inherently will never be as strong as your skin. At 2 weeks, scars are only 5% of the tensile strength of your skin. At lifetime, they're only 70%.
Wow.
So your body knows that. The body's an amazing thing. It knows that. So it's like, hey, this guy's probably going to go to the gym again. Let's put a little bit more collagen. That's what makes scars kind of look thick or big or raised.
Can anything be done to reduce the appearance of an old scar?
Yeah, laser resurfacing, microneedling, subcision, injections of certain medications. I mean, there's a whole world of scar revision. I love it. I think it's very gratifying, especially when you make scars look a lot better. I had a lady who had a really bad plastic surgery reconstruction for a tumor on her nose, and she is a prominent author here in Los Angeles and hadn't gone out for 2 years. Scar looked not that great, and it's an old scar, but we were able to do things so you can revise that collagen, revise the skin. Again, we come back to light because lasers are a form of light-based devices, and we can resurface the skin. I mean, we could do a lot of cool things for the skin.
Wow.
Yeah,
I because it's a horizontal incision, and so I was instructed not to do like pull-ups or pull-downs.
Yeah,
back
exactly.
in the gym.
And it's driving you crazy. You're like, dude, this is like, I need my endorphin rush from exercise. Like my body's dependent on feeling good, and I also don't want to not get not be in my routine. But you're like, I also don't want to break any stitches. I don't want my scar to look bad. So what do I do? It's the hardest thing.
It's the hardest thing.
I think. I don't know, a few months ago or a few weeks ago, I don't remember how long ago, I dropped a box cutter on my leg. I was like moving some boxes in the office, and there was a cutter on top, and I didn't know it was there, and it dropped and sliced my leg. And I think there's a video online of me stitching my ankle up. And I knew I couldn't run for like 2 weeks, and it was driving me crazy. I was like trying everything that I could, like flopping around like a fish in my bedroom trying to get there. So it's hard to change habits.
Oh, yeah. On my right pec, about 10 years ago, I had like a mole removed because they thought it had like
they were worried about something.
They were worried about something, yeah. So they removed it with this like border, and I completely ignored the doctor's advice to not work out for whatever the window was that he didn't want me to work out, because your pec is a very high tension area. It was like literally on the side of my pec, and so it's gone. It's like more or less gone now because it's been such a long time. But I remember for like years afterwards, it was like kind of hypertrophic. Like it was like raised
because of the tension, and I'm presuming maybe it's even widened from the tension in the pull. Yeah. But it's hard. Like, what's the lesser of the evils, right? Do you want an ugly looking scar, or is your day-to-day activity important enough, or your feeling is important enough that you're like, screw the scar?
Let's talk a little bit because I know you're a skin cancer expert.
Yeah.
Appreciate that. How do we prevent that? I mean, that seems to be
it's gotten it's wild. So I do a lot of surgery. I do a lot of kind of complicated high risk surgery. It was what I was recruited originally back to UCLA, where I was a professor for several years. It was what I was recruited to do. There's an epidemic of it, and there's probably three reasons I think. Number one is there's earlier diagnosis. So we're catching things smaller and earlier that probably wouldn't have been caught 50 years ago. Number two, people are living longer. So skin cancer and skin problems are a problem of generally adulthood, not childhood. And the longer we live, the more likely it is for things to show up that we didn't see when the average lifespan was 50. In the 1920s, the average lifespan was 52. That's unbelievable. We've almost doubled it.
It's crazy.
And then the third thing is something we haven't figured out yet, but I think there's something environmental. Now, when I say environmental, doesn't mean just from the outside in. It could be something we're consuming, something we're doing, because our generation is probably the most sun-averse generation in humanity, at least in the United States. And we are still seeing an increased incidence of skin cancer, which makes a lot of the experts scratch their head, because every dermatology ad that you see says sunscreen, and you won't get it. Well, it's not exactly the case, because we're seeing younger and younger patients develop them. Tanning booths were huge when I was a kid. I can't remember the last time I saw one. Being sun smart, sunscreen are really popular now. When I was a kid, we didn't have it, yet the incidence of certain skin cancers are increasing. So there's something we're doing that I think has immune dysregulation. It's either something we're eating, something we are getting in contact with, or a combination of such that's not allowing our immune system to survey damage that normally was corrected. And you see this in a lot of patients who have immunosuppressed statuses, whether they're transplant patients, lupus, what have you. They have an increased incidence of skin cancer regardless if they're in the sun or not. Now, does that mean Dr. Soleymani is saying go to the beach and get a sunburn? No, that's like common sense, right? The sun burns your body's ability to say, hey, you killed the top layer of my skin. Like, that's what a burn is. You killed it. So don't do that. But should we avoid the sun in risk of developing skin cancer? I don't think so. I think, well, number one, you got to know your family history. So if you tell me mom's had it, dad's had it, uncle's had it, grandma's had it, I'm Irish descent, everybody in my family's had it, your risk is a little bit higher. There's things we can do to mitigate that. Don't burn, obviously, but there's laser resurfacing, there's topical medications that can reduce your risk, oral supplements like we talked about, like nicotinamide, polypodium. There's oral plants that you can use and take that'll help reduce your risk. If you're somebody like me, I'm ethnically Armenian, not as common in my family history, maybe I can tolerate a little bit more sun. Maybe I don't have to be as diligent with the preventative measures, but there's definitely factors that we're ignoring that we're only now trying to elucidate. Like, is there something in the diet? Is there something that's messing our skin's immune system up that we're not recognizing? Everybody knows, sure, you get too much UV over many years, it's a problem. You get too much alcohol over many years, it's a problem. If you smoke too much over many years, it's a problem. But it's clearly not just sun related. And ironically, we talked about this weekend. The number one cause of death for young women in skin cancers that arise in sun-protected skin.
Wow.
They're not sun-driven. The majority of my patients' deaths, and unfortunately I have a lot of skin cancer deaths, are derived from skin cancers that either arise in sun-naive areas, or they don't have the same sun mutation signature that garden variety sun-damaged skin has.
What are some examples of these sun-naive areas?
Yeah, backs, backs of legs, melanoma, which has historically been our deadliest form of skin cancer. You know, Bob Marley died of it. You know, President Carter had it and miraculously got the immunotherapy that won the Nobel Prize, and he stayed alive because of it.
Wow.
Khloe Kardashian had it. And Bob Marley had it on his toenail.
Wow.
Wasn't tanning his toenail.
Yeah.
Right? Khloe had it on her cheek. You presume the majority of the makeup she's using and sunscreen she's using would protect her face more than, let's say, hands or some other place. So there's a lot of factors, and skin cancer comes in various forms. There's different types, some more sun-related, some less. But what I don't want people to do is have beef with the sun. You know, it's a good thing. You should be out there. You shouldn't burn, but when you feel good, your body will heal better. When your well-being is optimized, your body will heal. There was actually a study that came out of Sweden, I think it was 2016 or 2017, somewhere around there, that looked at women, 28,000 women, 20,000 women that avoided the sun for risk of melanoma. And they found that their all-cause and cardiovascular mortality was the equivalent to pack-a-day smokers.
Whoa.
Yeah. Now, they postulated that this is maybe linked to low vitamin D, something related to changes in endocrine signaling in the body because of the lack of sunlight, but
also nitric oxide. UVA rays create nitric oxide.
So exactly. So there's a lot of factors that make people scratch their head. Now, I think everybody has a threshold that's different. Like, I can be in the sun for, I don't know, an hour before my skin turns red. I don't know if that's the same for you. So you'll kind of gauge it, but I think being outside is totally fine and doesn't increase your risk for skin cancer so long as you're not constantly burning.
What about people who have a lot of moles?
Yeah. So another great question. Interestingly enough, the majority of melanoma, which is what we worry about in terms of moles, over 80 to 90% of melanomas will not ever arise in an existing mole. So why do we make a big stink about moles? It's because melanoma looks like an ugly mole. So it's like playing Where's Waldo. If you have a lot of moles, trying to find the bad one in that field is really hard. That said, the majority of melanomas that come in patients who have a lot of moles are not UV driven. There are certain specific mutations that occur that tend to have a genetic predisposition, which is why when we look at family history, that plays a really important role in deciding your risk factor. If you told me you've had one, you have a 10 times higher risk of having another one compared to myself. If you told me your mom and dad had one, you have a 5 times higher likelihood of developing another one compared to myself who's never had one. So obviously, moly skin, you worry, what's your subsequent risk? Now, the reason I keep pivoting on this like fine line of how much sun is too much, but the thing that we can't control and drives physicians overall really frustrated is we can't control your genetics. We can't do anything about what your genetic predisposition is. But what we can control is environmental insults. So every time you get a burn, you're killing your skin. You're saying, "Hey man, sorry, today we're gonna nuke the top layer," right? And the more that occurs, the more likely it is for one or two of these cells to say, "Man, I can't fix this anymore," and things go awry. So that's why we try to control environmental insults, because that's the one thing we have some say in. But majority of these things have a very strong genetic predisposition. So I don't want, dermatologists turned into this field where we almost guilt patients into thinking they did this to themselves. And we don't do that with any other organ system, with the exception of maybe lung, where we used to say, "Hey, you smoked, you did this to yourself." And now, ironically, the number one cause of lung cancer in the United States and the number one killer for lung cancer in the United States is non-smoking adenocarcinoma of the lung, which is wild. So now we have nothing to yell at patients about anyway.
Wow, non-smoking.
There's actually a New York Times article that came out this week for a Stanford professor who just got a terminal lung cancer diagnosis. He's 50 years old, non-smoker, never smoked, has one of these adenocarcinomas, and instead of quitting, he's giving a lecture. And it's really, really interesting. So the genetic component we can't control. The environmental component we can play somewhat of a role in. But I don't want patients to feel guilted. Far too often they're like, "Oh, that you tanned when you were a teen, didn't you?" I'm like, we never do that. If you had liver cancer or if you had some other cancer, we don't yell at you for saying, "Hey, you had that steak dinner in 1983, right? That's what did it." And it sucks, man. Patients feel like they're guilted that they got this thing, and it sucks. And most of skin cancers are on faces. Most of them are on functionally or cosmetically sensitive areas. So at least I can destigmatize it a little bit.
And how routinely should we be getting screened?
Great question. My opinion, once a year. Once a year, it's easy. It's non-invasive. It's not like getting a colonoscopy. It's a quick exam. You look at every single square inch of the skin. There's nothing else. It's a quick exam. If you have a strong family history, maybe twice a year. If you had a personal history of skin cancer, then you and your doctor will decide. But once a year, I think, is plenty.
And should you be insisting that they literally do look everywhere? Because I had a dermatologist. I just remember I had a dermatologist appointment a couple of years ago, and my intent going in was to get a full body, checkup because I'm prone to. I get moles.
Yeah.
And then the PA who came in to do the exam, she was like this cute girl. And so she asked me.
That happens.
Yeah. And she asked me if I wanted to keep my underwear on.
Yeah.
And I was like, yeah, I'll keep my underwear on.
Yeah. So I always have a chaperone in the room myself. It's just, it's an important thing. They should. And, it depends on how actively you're looking yourself, but generally they should. And, you can ask for like a male or a female or another physician to come in and take a look, but they should.
I mean, normally I would be totally okay with it.
Yeah. No, but I get it.
It would actually be fun. But I just, in that moment,
yeah.
I got kind of shy.
Yeah.
And
it happens.
Yeah,
it happens.
I was cognizant of the temperature in the room as well.
Yeah.
So,
Yeah, I mean, it's you're right, and there's a reason why I have a chaperone every time, not just for documentation purposes, but just to make sure everything is like as straightforward and medical as possible. But every square inch, I do see a lot of skin cancer in the genital area, and it's not sun related. It's HPV driven most of the time. So,
interesting.
And we see it a lot of young patients, and I operate on probably, I don't know, maybe 24 patients a year, maybe a couple a month, every month on genital squamous cells, both in men and women. That's driven by HPV, which is a sexually transmitted infection. So,
super common, right?
Super common. More than 80% of the population will have the antibodies towards it. Not everybody develops skin cancer or throat cancer or cervical cancer, but it's one of these silent viruses until it's not. Michael Douglas famously claimed that his throat cancer was from HPV, from oral sex.
Yeah.
So, and we see this. So, fortunately, there's a vaccine. Not that whether what your beliefs are in vaccines or not, this is one vaccine that will essentially eliminate your HPV-driven cancer risk. I got it during fellowship. Most of my head and neck surgeons have gotten it just because they know the risks. But I actually do a ton of genital surgery for these squamous cells that are not sun-driven. So another example of you can enjoy the sun, but that's why they should look at every square inch.
Yeah, for sure.
Yeah.
So there's a relationship between HPV and melanoma.
Squamous cell, it's a different type of skin cancer. Skin cancer comes in, there's many forms. The three most common are basal cell carcinoma, squamous cell carcinoma, and melanoma. Basal cell common, like Hugh Jackman has had several on his nose. Those are the more sun-related, less life-threatening, but more disfiguring skin cancers. Melanoma is historically the one that will kill you. And then squamous cell falls somewhere in between.
If your dermatologist wants to do a biopsy and the results come back with pre-cancerous cells, I mean, is this the kind of thing that you should be getting a second opinion for before they go in and they like cut out the mole around the margins like they did with me on my chest?
Yeah, so depends on what we're looking at. So there's these things called actinic keratoses, which are what you see in older patients that have rough, scaly red skin. And those are precancers leading to a type of skin cancer called squamous cell. And those are pretty uniformly treated. We usually spray them with liquid nitrogen or we give a cream to eradicate them. When we look at moles, the terminology for pre-melanoma or pre-cancer is widely variable and the data is changing. What we used to do 10 years ago, we don't do now. I used to be the director of the pigmented lesions and melanoma clinic at UCLA. It's one of my areas of expertise, and I would see this in the community a lot, is young patients would come in with tons of biopsies done, tons of surgery, especially in high mole density patients, and they're young, and none of them came back as melanoma, or if they had 100 biopsies, maybe one did. And we were cutting out, or the community was cutting out, everything that was even mildly atypical. Now we know we don't do that. Not even moderately atypical. So when it comes down to having surgery, I think having a second opinion from an expert is not a bad idea. Some of the more straightforward things that's uniformly accepted, I think is fine. And you know, it's never a bad thing to get a second opinion. I always say this: if you're going to undergo surgery, you should have opinion from at least 2, if not 3 doctors. If they all say the same thing, awesome. If you get 3 different answers, then wait a little bit. Let's figure out what's going on.
Okay, here's a question.
Yeah.
And by asking it, I'm not endorsing the idea, and it's a controversial question, so feel free to plead the fifth. But
Sure.
sometimes in the carnivore community, you hear that when people eliminate their consumption of seed oils, which have now entered the public zeitgeist, right? Refined, bleached, and deodorized, soybean oil, corn oil, canola oil, which are now like the most dominant fats in the standard American diet. They'll claim that they stop getting sunburned. Is there any scientific merit to that, to those anecdotes? Plausibility?
There's so many variables in that statement. It's hard. They're onto something. There's something about a high inflammatory, I even call it an incendiary diet, that portends the body's inability to heal because it causes immune dysregulation. And we're only now just breaking the tip of the iceberg in terms of diet's ability to modulate our immune system, and then having our immune system either working well or not working well, right? But did they get the same UV exposure, same time of day, same latitude, same duration? You know, there's so many factors that is hard to, so many variables that is hard to match, that I don't know if I can say for certain. I wouldn't be surprised, though, if it was a controlled trial or a controlled study, that there's some truth to that, because cutting out very inflammatory things in our diet can help our body heal a little bit faster. Now, sunburns tend not, you know, your immune system going in to fix a sunburn is in the later stage. So I don't think you can really mitigate the body's ability to not die. That's essentially what they're saying. But I think there is a component of how bad of a sunburn you get. Just, we have yet to see. So I think I have an open opinion about it. I think I have an open mind to it. I don't think it's implausible. I don't think that there's so many variables that need to be matched before I can say, yeah, I agree with that or not. But
no, I mean, I love that you're open-minded to the possibility. I mean, we need research on this, obviously, before talking about it. But I appreciate what you said about the fact that there are likely lots of variables that are being tweaked compared to your average person on the standard American diet
100%.
For somebody who has adopted a very strict carnivore diet. I mean, they're likely eliminating their consumption of ultra-processed foods and so doing, certainly eliminating seed oils. But, you know, these are biologically active fats that bioaccumulate.
Yeah. The problem with doing studies like this is you've been eating them for 20 years. Now you got to erase them for a period of time. So there's such long longitudinal studies that if you want to see outcomes, you're talking 10, 20-year outcomes. And by the time we get that data, who knows what kick we're going to be on now. But I mean, I'm not opposed to it. I think there's enough validity into looking at the diet and its ability to affect the skin.
When it comes to sunblock, what do people ought to know? What are the biggest myths about sunscreen and sun protection?
So this is a hot topic. I got a lot of opinions on it. So the FDA considers sunscreen or sunblock, which it used to historically be called sunblock, an over-the-counter drug. It's highly regulated. You can't come out with a sunscreen, a new formulation of a sunscreen, without FDA approval unless you use one of their existing ones. The original FDA manuscript that came out in '99 had a bunch of chemicals as well as minerals that was determined, generally recognized as safe and effective. Now, fast forward 20 years, we found that maybe not all of these chemicals, because of their metabolic breakdown products, are generally recognized as safe and effective, which means all the stuff we were smearing on our skin from maybe 1999 to 2015, 18, 20, maybe not all of those are safe. In fact, some of them have been pulled off the shelf. I think sunblock is great. If you're going to burn, you use it to shield your skin. It's a way to protect your skin from the outside in. I tend to recommend only mineral-based sunscreens. It's the old 1980s Lifeguard white nose sunscreens. They are minerals. They're made of metals, either zinc or titanium. They sit on the surface of the skin, and they don't undergo a chemical transformation. The problem with those sunscreens are they tend to be greasy, chalky. They tend to have a little grainy texture because of the nanoparticles or the small particles of metal. So in the 80s, 90s, 2000s, people didn't like applying makeup on top of that because the skin looked chalky. So the cosmeceutical industry came out with chemicals that would sit on the skin much more smoothly, that can be blended into things like makeups, that can provide the same SPF equivalent. The problem is the way the chemicals work is they have to absorb UV and they undergo a chemical transformation, and then they release that energy as heat. This transformation occurs on your skin or in your skin. What we found inadvertently is a lot of these chemicals have metabolic breakdown products that are thought to be maybe carcinogenic or endocrine disrupting. The amount of which you need is generally much, much higher than what people are smearing on. You need about a shot glass worth of sunscreen for it to even be effective. And as a skin cancer surgeon myself, oftentimes I don't put that much on. So how much people are putting on is widely variable, but in general, most of these studies that looked at these chemicals and found the metabolic breakdowns to be a problem are at doses that are really, really high. Now, even if you make that argument, I tend to be in the camp of saying, hey, if there's an iota of fear about this or an iota of data suggesting this is not as safe as we thought, why don't we pick the more effective, safe option? You know, if there's even a shred of this is maybe carcinogenic, you're going to be applying it every day for 40, 50, 60 years of your life. Sooner or later, there's some bioaccumulation. And we saw a really good study that came out in JAMA, which is one of our pinnacle medical journals, that looked at when patients applied even a single dose of a chemical sunscreen, the blood detection of that chemical, like in the actual blood after applying it onto the skin, ranged from 190 to 500 times the upper limit of normal defined by the FDA. So we're like, wait a second, we're absorbing a little bit more than we thought. And we've known this for a long time, which is why the American Academy of Pediatrics and the American Academy of Dermatology will tell you can't put certain sunscreens on babies before 6 months because their skin is like a sponge. They're like mucous membranes. They will absorb it. And we know the absorption's a problem. So now you're thinking, well, if it's a problem for a baby, it may not be a problem for me on day one, but it may be a problem for me on day 110,000, right? So I tend to recommend mineral sunscreens. I think sunscreens are great. I think there are also other forms of sun protection that work great. There are, in every single study, shade and shelter, hat, shade, have outperformed sunscreens. You literally cannot burn in shade, right? So if you're worried about burning or you're worried about aesthetics or you don't want to age because of too much sun exposure, a sun umbrella will beat any sunscreen you put on. But there are oral supplements that can protect your skin from the inside out. Things like polypodium, nicotinamide combination can protect your skin against sunburns or increase the amount of time you can spend in the sun. There's UV protective clothing if you're high risk. So sunscreens are a great way, not the only way.
Yeah, and they're not a free lunch. Like even the chemical
100%.
sunscreens, like if you're at risk for developing a really bad sunburn, I mean it's better than using nothing. Like if there's 100%. No shade available,
100%,
right? But yeah, these chemicals are, they've been flagged as having serious endocrine disrupting potential.
And ironically, the biggest problem was not even in the sunscreen itself, but a lot of these sprays had benzene as a propellant additive. So the sunscreen itself wasn't a problem. The form that you were getting it was inhalation of benzene. So there was a massive recall and some class action lawsuits and whatnot. So every time we do this, and we do this in medicine all the time, we take 2 steps forward and then like half a step sideways. And we're like, where are we now? So good old fashioned zinc or titanium is what I recommend. Creams, not sprays, not anything that's inhalational. And you should know your skin. If you're gonna burn, you should use some form of protection, shade, shelter, sunscreen. If you're not gonna burn, I don't think you necessarily need to put it on every day, with the exception of if you're really aesthetically driven. If you're worried about aging, things like that, then by all means, or if you have certain sun-sensitive skin conditions like melasma, lupus, etc., then you'll want to protect yourself every day. But Do I wear sunscreen every day? I don't. Most of my time is spent going from my house to the operating table, to the lab, back home. So I know my skin. If I'm going to be at the beach, I'll wear it. No doubt about it. Also probably take a supplement.
Speaking of supplements, are you at all familiar with astaxanthin?
Yes.
You are?
Yes. I love astaxanthin.
It's one of my favorite nutrients.
Yeah, we have a whole video about astaxanthin. There's a product called Sun Powder that we use, and we formulated with my partner over at Harvard when he was at Harvard and I was up at Stanford, then over at UCLA. It actually has astaxanthin in it, a full clinical dose. And we found that it improves not only skin texture, but it improves fine lines and wrinkles. And there's some sun protective measures with astaxanthin.
Are you talking about oral supplementation
Yeah,
or topical?
oral.
Oh, oral. Wow.
Yeah. The oral supplement's great. And there's several studies that we talk about in certain videos looking at patients who got oral supplementation anywhere from 4 milligrams to 12 milligrams. And we looked at them over time and they had a 30% improvement in all of those measures.
Whoa.
Yeah, astaxanthin's great.
It's
and
amazing.
most people in the skin world don't know about it. We added it to our supplement called Sun Powder, but that's one of the many things that you can use. It goes back to antioxidation, right? So if you have an inflammatory diet, if you're doing things that cause inflammation, you want some sink, some way to absorb that oxidative stress. Astaxanthin is phenomenal.
Yeah, it's I became an advisor in a company called AX3 who makes a really bioavailable form of it. Just because way before I had any kind of affiliation with a producer, I've been taking astaxanthin for like 15 years. If not
it's
more
awesome
at this point. Yeah.
There's literally no downside. It's a great antioxidant and it does a lot of things both internally and externally.
So cool. A lot of people are talking about tallow now, like beef tallow.
Yeah.
If we're getting into territory that's too woo-woo for somebody with
we
your
could talk about it.
Yeah, with your pedigree, I mean, let me know.
That.
But people are now, tallow is now being, replaced in the fryer setting at various restaurants. But there are, now manufacturers of cosmetic products using tallow as skincare, like as moisturizing, as a moisturizer. What are your thoughts on that?
I have a lot of patients that use tallow.
Really?
A lot of patients that believe in it. I have a very simple approach to it. If your skin's tolerating it fine, you're not having any issues, by all means, use it. Why not? I see there's a lot of online presence from a lot of dermatologists, especially in social media platforms, like bashing it. I don't necessarily stand on that. I have a lot of patients whose skin looks great and they've been using it for a long time. There's nothing wrong with it. But if you are acne prone, you're young, you're in your teens, and you're having worsening acne because you're using that, stop it. That's probably your source of comedogenesis, which means clogging of your pores to cause breakouts. If you're not having any problem with it, I don't see why not. People come up with theories as to why you can or cannot. But the first thing you learn in medicine is treat the patient, not the lab. So if your skin looks great and you're telling me tallow is working, great. By all means, use it. Now, if I use it, will I have the same response as you? Maybe not. And that's where every individualized plan is key. Every individualized treatment, skincare regimen, etc., is really important. But I'm for it if you're not having a problem with it.
Well, it's like fat from a mammal. It would appear, at least, on the surface, to be biocompatible. I mean, we can eat it.
Yeah. I have no problem. The only thing that I can think that it can cause, honestly, long term, is just breakouts, because it essentially clogs the pore. But tallow is a very fascinating concept because in the Middle East, there is this old wives' tale in which wounds, like injuries, surgical wounds, are healed with certain tallow that's been used for hundreds of years in the Middle East. And it's like prized tallow, actually from donkeys, not cows, but for hundreds of years in the Middle East, in many populations, they use this form of tallow on incisions and wounds as like a rural medicine technique.
Whoa.
And people swear by it. And now it's kind of gotten glamorized again back in current culture and American culture, but I have no problem with it.
I didn't realize that about the Middle East.
Yeah, it's really, really fascinating.
It's like this cultural,
You learn like little bits from different, cultures once you get to know people, and you dive into other cultures, and you really, we tend to do these circles in medicine. We do things that we did 100 years ago, then science changed a little bit and said you can't do that. Then we go back, and like sunlight now is back. Sunlight was back in the 20s and 30s and 40s. It was great. Then sunlight maybe was not back in the 80s, 90s, and 2000s. It was blasphemy, and we're realizing, holy crap, it's not just sun. The sun makes people feel good, and there's stuff we're missing because we're avoiding the sun. So the sun's back. And we do this like interesting circle, and you'll find those like truths in different populations and different communities. Like the astaxanthin thing is really popular in a lot of cultures, and they get it mostly from their diet, especially Asian populations and cultures. And we're now just realizing it in the Western society. So all of medicine and like diet and habits are fascinating. The more you dive into it, you find the connections.
Well, it's frustrating. It's got to be frustrating for somebody as open-minded as you are, who's trained in Western medicine, but also is aware and seemingly has embraced these more traditional modalities that we so frequently will demonize something that has been around for such a long time, like whether it's the sun or animal source foods or
100%.
It's just crazy.
There's a couple reasons for that, man. I think if you see enough of something or you treat enough of something, you'll start to get to a point where you don't have an answer for some outcome. You can't wrap your head around why this didn't work the same way it did for something else. And that's when you start accepting or believing other beliefs that was told not to be true. Now, do I think you should tan your perineum? People do that? No, I don't think you should. It'll burn, you do nothing, and I operate there all the time, and the wounds don't heal great. So I don't do that. But, being open to the sun or, tallow, things like that is not unreasonable. From a skin cancer standpoint, I see a lot of patients that succumb to their disease. And in dermatology, usually people go into dermatology partly because it's a feel-good specialty. People aren't dying, but I tend to pick the patient population that are the sickest. And most of these patients, I can't pinpoint sun as a culprit. So I open my eyes to saying, hey, maybe it's not just all that. Maybe there's something else. And that's like really where, good scientific basis should be. You should question the paradigms all the time. And if you should test out alternatives, and if the test proves true, then you change your opinion on it. If it doesn't hold true, then you stick to your original ground.
I've always said my approach is evidence-based, but not evidence-bound. We have to
100%, man, 100%. And then there's unfortunately, money dictates everything. So there's money in industry and swaying of opinions because of that. You go to Europe and you can have pasta 3 times a day, 5 days a week, and you come back 3 pounds lighter. I have pasta for a week here in the States and I feel like shit. And you scratch your head saying, dude, I think I'm eating the same thing. It looks the same, but what am I missing here? And then you start diving deep and seeing where the changes occur and why they occur. And that always frustrates me. Every time I'm in Italy, I'm like having pizza and pasta and I feel better than I've ever have. And partly maybe because I'm on vacation, I'm not working, but partly there's something in the food and there's something in the manufacturing and processing. So that part we can't control. That's a factor that I think sways medicine and health in the United States more than anywhere else in the U.S. is money and industry and lobbying, things like that.
Yeah. So butthole sunning, not something that you endorse?
I mean, unless your specific profession needs it, which there's other ways to do, but no, I don't need, I've tried to reason about every angle and even entertain the idea of because our gut, it's been theorized and there's some data to it that our gut has the second brain in terms of its nervous system attachment. There's a reason why you have a feeling in your stomach when something is lurking around the corner, but your brain doesn't know. That's actually your primitive brain telling you, hey, you're in danger. It's fascinating. You get that pit in your stomach when something goes wrong and it hasn't even happened yet. But let's say you, I don't know, forgot to answer the back page of a test and your stomach drops. Your brain knew you forgot to answer, but your stomach's given the feeling. So there is a primitive brain behind it. So I tried to even reason saying maybe they're saying that there's sun that goes to the nervous system connected to the gut. But I'm like, man, I cut out cancers there all the time. And last thing you want is to add one there because you got sun where it shouldn't get.
Yeah.
So maybe don't do that.
Well, yeah, I wonder if because I've thought about it too. Like, it's not something that I do, but maybe they say that sunlight is the best disinfectant, and maybe some people that have like too much moisture, or there's like bacterial overgrowth in one's nether regions, maybe there's
So we talk about bacteria a lot, and I see like bacteria talked about ad nauseum. Like there's tests about like, oh, if you don't wash your pillow. I saw this on Instagram today before I got here. It says if you don't wash your pillow at least once a week, there's 500 times as much bacteria on the pillow sheet than on a toilet bowl. That may be all good skin bacteria.
Yeah.
There's a ton of bacteria in the perianal area. That's your normal gut microbiome. Those aren't bad pathogens. We talk about this. It's like, over cleanliness in the United States, over cleansing, sterilizing. And I don't think you need that. I don't think and sunlight doesn't kill anything besides maybe a couple viruses. But so that's like the common misconception I hear. But most of these studies don't even tell you if the bacteria are good or bad. Maybe you want those things. Maybe, if I swabbed your cheek and ran in a petri dish, we'd get a bunch of things grow out. Should those be deleted? No, they're actually the barrier towards pathogens coming in. You have trillions of bacteria. Your skin's microbiome and your gut's microbiome mirror each other. And interestingly enough, one of the reasons why we see the changes with diet is when you affect inflammation in the gut, you change the microbiome's metabolic byproduct. So these little bacteria in your gut eat the food and they process it. When they process things that they don't like or is inflammatory, their waste byproduct tends to be inflammatory, and you see the response in the skin. So the gut microbiome, the skin microbiome, and Stanford was really good at teaching all this, is very connected. So I don't think this whole bacteria thing is a problem. In fact, when we over cleanse is when we run into issues. In the United States and westernized countries in Europe, we have way more autoimmune skin disease because of over cleanliness than in other countries. Like I let my kids run and play and muck in the dirt and do all this stuff because I know that they're building some immune tolerance. Now, does that mean I don't treat an infection? Of course I do. But there's over sterility, over cleanliness leads to our body's inability to recognize normal from abnormal, and then it fights things it shouldn't. So we know in countries that don't over sterilize and cleanse, their rates of eczema are lower, their rates of autoimmune disease are lower, their immune tolerance is higher. So yeah,
it's a hygiene hypothesis.
Yeah, it is. It's very true. I mean, you see it all the time. Peanut allergies, skin allergies, this atopic diathesis, which is seasonal allergies, eczema, asthma. They go together with a branch of the immune system. You can mitigate that by just letting your kids like roll around in the dirt for a while when they're growing up. You can help reduce the likelihood of having that. Now, if you have a strong family history, your genetics will win. The mud will not. But there's nothing wrong with bacteria. There's nothing wrong with mud. So there's nothing wrong with dirt, so long as it's not pathogenic. And how do you know if something's pathogenic? Your body will tell you. You'll get a painful breakout. You'll get an infection. You'll get cellulitis. You'll get things that you're like, oh shit, I need to take care of this. But
yeah. Wow, so interesting. Yeah, I mean, I don't know anybody. I feel like most of my friends, not all, but most have some kind of autoimmune, have struggled, at least are presently or in the past with some kind of autoimmune condition.
Yeah, and there's an interesting role in sunlight in that. There's an interesting role. We see that one of the quintessential autoimmune conditions or immune-mediated conditions is multiple sclerosis. Now, this has nothing to do with skin, but we're going to talk about sunlight. And when we look at population studies for multiple sclerosis, patients from northern latitudes with less sunlight and tangentially less vitamin D tend to have much higher rates of multiple sclerosis. And you can mitigate your risk by just moving to a sunnier place in the world before a certain age.
Wow.
So if you moved from, let's say, like Scandinavian countries down to equatorial levels before the age of around 14, 15, your risk reduces the same way if you grew up in that sunny area.
Wow.
Yeah, it's fascinating, man.
There was a study a couple of weeks ago that came out that I shared to my newsletter. There's it's rare, but pediatric onset multiple sclerosis is more common in babies who are sun avoidant for whatever reason, due to parental influence or whatever. But babies who got at least 30 minutes of daily summer sun in their first year of life had a 33% lower risk of relapse if they were later diagnosed with pediatric onset multiple sclerosis.
Interesting.
And on top of that, if a child's biological mother had at least 30 minutes of daily sun during her second trimester, the child's relapse risk was also lower.
That's fascinating.
Yeah.
Now, there's like asterisks to those studies because pediatric MS is so rare. So we wonder, is this correlation or causation? But it fits the paradigm of, we saw that when families who had strong multiple sclerosis genetics, or patients with a history of multiple sclerosis or family members, if they moved down in adolescence to sunny areas, their risk became the same as the sunny latitudes. But if you moved in adulthood, your risk maintained as if you were in the dark areas. Not to say that Scandinavia is dark, but you get what I mean.
Yeah.
So the sunlight, we're going back to realizing like, hey, maybe we shouldn't avoid the sun. Maybe we shouldn't replace everything that the sun provides with pills and potions and creams and lotions. Maybe there's some good to this, man. And we're going again back full circle.
Amen.
Yeah.
Well, dude, this was so fun.
Yeah, this was awesome. Thanks for having me on.
So much fun. You're a wealth of insight.
I appreciate that.
Yeah, and I feel like...
Thanks for having me.
Yeah, come back whenever you want.
I appreciate that. I feel like I can talk about stuff forever, like skin, immune system, biology, gut health, gut connection. This is stuff that everybody can tweak. You know, it's like not getting chemotherapy. It's not surgery. It's simple stuff that you can modulate with good evidence. Obviously, like maybe not the perineal tanning stuff, but with good evidence that can improve your health. So why not?
Amen.
Yeah.
Amen.
Appreciate that, man.
Well, where can listeners connect with you on social media? How can they support your work? I've got one last question for you, but remind listeners where they can find you.
We have a small social media presence. It's just my name, Teo Soleymani, MD, and my practice has a name, CDMS Dermatology. And then for anybody who's like interested in supplements that help protect against skin, we have a company called Sun Powder. It's actually the first daily drinkable supplement that protects your skin against skin cancer and sunburns and premature aging. So that's something that we launched about 6 months ago. But yeah, you guys can find me anywhere. Pretty much everybody has my number.
Love it.
All my patients, my friends, colleagues, referring, everybody has my number. You guys can find me anywhere.
Awesome, man.
Yeah.
Well, this was super fun.
Appreciate that.
Last question that gets asked everybody on the show. What does living a genius life mean to you?
It's a great question. I think it's knowing what you don't know and being open to changing it.
Hear, hear.
Yeah, I think it's not being fixed in your ways. I think it's being able to pivot based on good evidence. I think it's just knowing what you don't know. And the more you get into something, whatever your specialty may be, whatever your expertise may be, the more you get into something, the more you realize you don't know what you don't know. And being open to changing thoughts and paradigms, I think, is what genius is all about.
Amen. Strong opinions loosely held.
Yeah, exactly right, man. Exactly. That's a nice way to say it.
Yeah.
Like that. Yeah.
There
Cool.
you go. Hey, if you like that video, you need to check out this one here, and I'll see you there.